A concussion is a condition that occurs where there is a biomechanical force either to the head or somewhere else to the body where the force is transmitted to the head. There is no such thing as a good concussion. And certainly we believe that repeated head knocks in relation to a concussion, and sometimes even head knocks that aren't diagnosed as a concussion, can potentially have long-term effects. One of the challenges in diagnosing and managing concussion is that there are no simple objective tests which can say that someone either does or doesn't have concussion. There is no blood test, there is no medical imaging scan that definitively diagnoses concussion. We still rely on clinical assessment, clinical judgment, and specific tools like the Sport Concussion Assessment Tool to take us through a range of domains which can then help us come to conclusions as to whether there is or is not concussion present.
Medical practitioners can use the Sports Concussion Assessment Tool 6, SCAT-6, to assess for concussion and the potential consequences. The Child Sport Concussion Assessment Tool, Child SCAT-6, can be used to assess for concussion in children aged 5 to 12 years. People without medical training can use the Concussion Recognition Tool.
One of the most commonly used tools by healthcare practitioners around the world is the Sport Concussion Assessment Tool. This is a structured assessment tool which provides a framework whereby doctors can assess a patient taking into account a range of different domains, including physical examination, symptom load, memory, attention, coordination and balance. So all of these domains are assessed as part of the Sport Concussion Assessment Tool, or SCAT, and this really helps the medical practitioner or healthcare practitioner decide on whether this person is concussed or not. It's really important that all Australians have an awareness of the potential for concussion in sport, occurring obviously not just in the organised sports setting. I mean, we know that 75% of concussions that occur in children are not related to organised sporting activity. They're related to, bike riding, falling off the swings, falling off the monkey bars, etc. For children aged between 5 and 12, there is the Child Sport Concussion Assessment Tool, the Child SCAT, and that has some modification of the questions to make it more age appropriate. Where you're in a situation where you're dealing with an athlete that you don't know very well, I'd say you have to err on the side of caution. Sometimes when a doctor is very familiar with the athlete, it's a bit more clear to them that this person is not themselves, they're not behaving the way they normally behave. When a doctor is assessing someone they're not familiar with, often there's a need to corroborate evidence with others, so teammates, parents, coaches, to talk to them. Are you concerned about this person? Is this person behaving not as you would normally expect? And also to corroborate the specific incidents of what happened around the time of concussion. Did they appear to lose consciousness? Were they unsteady on their feet? It's really important to try and use information that you can gather from those that know the athlete and were around the athlete at the time of the incident. You just have to err on the side of caution, and if there's any suggestion that this person could be concussed, they should be removed from the field of play and treated as per standard concussion protocol. In concussion, it's just as important as anywhere else that we draw on the skills of all the practitioners around us. So while the doctor certainly has a role in assessment and monitoring of the progress of someone with concussion, we certainly value the input of our physiotherapy colleagues in providing vestibulo-oculomotor rehabilitation to ensure that this athlete makes the best recovery they possibly can before they're returned to contact or collision activities.
In recent years, there's been a huge increase in the participation of females in collision and contact sports. Research into concussions for female athletes is realistically just in its infancy. And what it's showing is that potentially female athletes are taking longer to recover from concussion than male athletes. And the reasons behind this still remain unclear.
There is growing concern in the community about CTE, which is chronic traumatic encephalopathy. CTE is a histopathological diagnosis. That is, it's a diagnosis that can only really be made at autopsy of the brain once someone has passed away. But it is a form of tauopathy, a degenerative brain disease. It's related to, but different to, diseases like Alzheimer's disease, and it is related to repeated head trauma.
When concussion occurs, the athlete should enter into a structured graded return to sport process for both their learning and sporting activities.
It's also important for Australians to understand that if diagnosed at the time of concussion and appropriate management takes place in terms of removal from sport and no premature return to sport, that most concussions most people who suffer concussion will have that concussion resolved, they'll make a full recovery, and they'll be able to return to sporting activities and all other activities without any medium-term or long-term consequences. However, there is a small proportion of athletes who have suffered repeated head trauma who will go on to develop CTE. At the moment, it seems that the numbers of people who will suffer CTE compared, say, to the number of people who will suffer sport-related concussion is very small, but one case of CTE is too many, and the AIS and the ASC would never seek to diminish or trivialise CTE. But I think we also need to understand that there is an abundance of level 1 evidence about the enormous emotional, psychological and physical benefits of involvement in sport, particularly team sports, where there's a great social interaction that occurs. That's particularly important for the mental health for children and adolescents and young adults. And while we need to be concerned about concussion in sport, we would not like to see this concern become so great that people start to withdraw their children from participating in team sports that have so much to offer to the enrichment of that person's life.
If in doubt, sit them out.
If in doubt, sit them out.